Hello everyone, welcome to the March episode of Health on the Beat. My name is Shanice, a nutritionist from VitaHealth, and I will be hosting the episode today. So in conjunction of the International Days of Happiness, which fall on the 20th of March, I would like to remind all of you guys, including myself, to seek happiness not only from the outside, but to seek it inside as well. And the virtual life of social media has allowed us to share anything and everything at any time, and with all sort of beauty filters here and there. So we have a very strong desire for external beauty and tend to forget to actually take good care of ourselves. So today, in this episode, we are going to discuss about how to take good care of ourselves internally, especially the guts. So as the saying goes, healthy body actually starts from a healthy guts. So today, we are very honored to have a guest today, which is Dr. Khairil from the KMI Kelana Jaya Medical Center with us. So let us welcome Dr. Khairil.
Yes, thank you, Shanice. Thank you for having me.
It's our pleasure to have you here. So would you like to introduce a little bit about yourself?
My name is Muhammad Khairil Abdul Khalil. I'm a general surgeon working in KMI, Kelana Jaya Medical Center. I graduated from International Islamic University and did my master in UKM.
I guess you have already treated a lot of different kind of medical conditions, right?
Yes.
So before this, right, I think all of us knows that Raya is around the corners, and it's so great to be able to celebrate with all the families and friends and having multiple celebrations. And I guess feasting after long hour fasting needs careful planning because it might cause problems in the gut health. So to ensure a healthy gut, Dr. Khairil, can you share with us a little bit more on how does it affect our guts?
Okay. When it comes to fasting month, especially those patients diagnosed with gastroesophageal reflux disease, their major concern is whether they can fast or not during this fasting month.
I see.
So the answer is absolutely yes, they can fast.
Okay.
But with certain precautions.
I
They
see.
have to be compliant with their medication, follow the doctor's advice, and there are some fluid restrictions they need to follow.
I see. So those who have like gut cell concern is definitely need careful planning. And also you spoke about some of the guts problems. Can you mention a few, like what are the example of most prevalent guts problems that you found, especially during the Raya period?
Most common is, we call it as acid reflux disease, or the full term is gastroesophageal reflux disease. It's we call it GERD.
Yeah.
Layman, we always call it as GERD.
Yeah.
So it's basically defined as acid reflux from the stomach goes back into the esophagus. So there's a backflow of acid. Suppose the acid goes down into the small bowel, but instead of going down, the acid reflux going upward then affecting the distal part of the esophagus.
So Dr. Khairil, have you ever treated any medical condition that you find it is very important to share over to all of us and to remind us on how important it is to take care of our health?
I still remember there's a patient of mine, last time in his mid-40s. He came into our casualty complaining of a severe chest pain. So everybody was like jumping around, see, whether are we dealing with a heart attack here? He's complaining of chest pain, very severe chest pain, a little bit of shortness of breath, and then we did an ECG, we did a blood test, and then everything came back as normal.
I see.
So the ECG was normal, the blood test was normal, and then end up with the diagnosis of severe gastroesophageal reflux disease.
I see.
So, turning to our discussion today, I think it's important for us to understand about GERD because it can actually mimic a heart attack, but it's not a heart attack.
Yes, the symptom is very similar.
Yes.
So we can see that it's really important to understand like the sign and symptom of the GERD, which is the gastroesophagus diseases. So, and it's wonderful that you have been dedicating yourself to treating all this kind of medical condition, especially issue related to the gut health. But I think a lot of us tend to neglect all the signs and symptoms related to the gut functions. And moreover, one of the gut health issue which you mentioned, the GERDs, it looks so similar and so common as the common acid reflux that we normally experiences, and this is making us taking this issue lightly. So could you enlighten us, like, how do we identify the occurrence of the GERD?
The symptoms are quite a wide spectrum actually, but basically we doctors, we divide it into the typical and also the atypical.
Yeah, I see.
So being the most common, the typical symptoms are like regurgitation,
Okay.
heartburn, and also like water breath, and also like acid breath sensation in the throat. And there are atypical symptoms like I mentioned just now, chest pain, mimicking heart attack, cardiac event. And those with severe forms, they can come with cough, especially at night. We call it nocturnal cough.
I see.
Some patients, they do come with dental caries.
Oh, okay.
It reflects the chronicity of the disease. They
I
can come
see.
with dental caries, they can come with recurrent lung infection, pneumonia. Sometimes they get this, we call it globus, like something, there's a sensation in the throat, uneasiness in the throat, something reside in the throat, but it's actually nothing there.
I see.
It's just a sensation.
Do they feel pain?
It's not pain, more like towards discomfort.
Okay, I see. So we spoke about a few gut diseases, and I guess there are a few terms used among all of them, like GERD, acid reflux, heartburn. Is there any differences between all this?
Okay, basically GERD, acid reflux, and also what's the other one?
The heartburn.
Heartburn. These are words that we use interchangeably.
I see.
They are actually the same. They carry the same meaning, same terminology.
I see.
So if I were to arrange the words, GERD is characterized by acid reflux causing heartburn. The definition of GERD is acid reflux. The pathology behind it is acid reflux. But the manifestation of the disease itself is heartburn. But people like to use the words interchangeably. It's actually the same.
I see. Yeah, so we have learned a lot like about these three different terms. So it's actually interchangeable. So Dr. Khairil, can you share like a bit about what is the exact cause of GERD?
Okay, there are many causes, but being the most causes of GERD is when there's a motility disorder affecting the esophagus. And one more is when there's a problem with the lower esophagus sphincter. It's like when the valve at the lower esophagus is not functioning.
I see.
As normal. But it's not actually an anatomical valve. It's a physiological valve. So whenever foods arrive at the junction, the sphincter itself fail to relax. To contract well. So causing relaxation of the valve.
I see.
So when the valve is not functioning well, acid from the stomach tends to go up into the esophagus.
Okay, that's why they'll feel some taste, different weird taste during the issue when it happened. Yeah. And how about obesity, people or pregnant?
Yes, of course, because of in obesity and those pregnant ladies, they have this so-called increase in intra-abdominal pressure because of their body habitus. And among obese people, they have this so-called hiatus hernia.
Hiatus hernia, I see.
It's a structural abnormality at the junction. So they tend to get reflux disease because of the body habitus, underlying obesity, as well as because of pregnancy.
So yes, you can see that obese people and pregnant people will have a higher prevalence or higher risk of getting all
not necessarily, but they are more prone to get.
Yes, more prone to get. So to have this GERD. So Dr. Khairil, it seems that like a damaged gut can cause a lot of other health consequences. And what happens if this situation, which is the GERD, left untreated? Is there any surgery needed, or actually just lifestyle change and normal changes or medication is already sufficient to treat it or to relieve it?
Okay, fortunately, it not necessarily need to go for surgery because in the long run, the complication of GERD, patients are prone to get so-called, we call it buried esophagus. Because of the chronic reflux, the distal part of the esophagus become inflamed, and then the cell tissue tend to replaced by a normal tissue. We call it columnar columnar metaplastic change.
Okay.
So Barrett, we call it as a pre-malignant condition. So it's actually need a proper surveillance, need a proper biopsy, so that we can prevent the occurrence of esophageal cancer. Okay. Another complication in the long run, esophagitis, they can get stricture because of the excessive scarring, fibrosis of the esophageal lining. So the patient will come with, we call it dysphagia, difficulty to swallow. So
usually it happens to the elderly, but I guess for youngster, it happens also very
That's
often.
why we need to, our concern is the alarming sign, which are anemia, difficulty in swallowing, and also unexplained weight loss.
I see,
unexplained weight loss. Reflux, they present with dysphagia, difficulty to swallow, and then we notice that patient got very significant weight loss. And then that's the red flag, the alarming sign that you are dealing with cancer.
I see, okay. Well, I think weight loss is a very happy term to hear here. Everybody want to lose weight, but in this kind of situation, it is dangerous because like just now what doctor has mentioned, it can actually relate it to cancer, which means that the treatments and the precautions taken is very important. So just now I also have a question about surgery. So what is the role of the surgery in GERD?
Okay, as I mentioned, about 70% of patients, it's safe to say about 70% of patients don't need surgery. We can actually go with medication alone. Of course, lifestyle modification plays a role, weight reduction plays a role, and we always advise for cessation of smoking and alcohol. So the medication that we give includes antacids, proton pump inhibitors, as well as prokinetic agents. So what about those who need surgery? About less than 30% of them.
Wow,
Could be lesser. They are mainly because either they are not compliant with the medication, or they develop side effect towards medication.
I see.
Or in other case because of morbid obesity.
I see.
So it's difficult to reduce their weight. So in this group of patients, we do advise for surgery.
I see.
And the surgery that we do, the surgeon with the upper GI specialty, we can offer a fundoplication. We call it Nissen fundoplication. We actually wrap and tighten the junction.
Oh, tighten the junction so that the acid doesn't go up, reflux easily. Okay. But I hear an important point just now is that it is about less than 30% of the patient will require surgery. So what does it mean? It actually means that the rest of the people need to take precautions by taking a lot of lifestyle change, especially the dietary change, right? So an imbalanced gut microbiota will actually further affect the stomach lining that's caused by the imbalance of the gastric pH level. So we have seen a lot of bad habits from all your patients, I guess, when they are not taking good care of their guts. So what are those bad habits that you have seen in your patients that are making their gut situation worse?
Okay, quite a numbers, but the most common is non-compliance to medication because of their hectic lifestyle. And because of this, there's no dietary restriction. Being Malaysian, street food everywhere, 24 hours.
Very hard to avoid.
Easily accessible now with the availability of Grab food some more.
Okay.
So easily accessible, 24 hours. And being the most common is they always have this habit to have a meal before, time before bed. So it's basically a late dinner. So it's actually not good for their health. Because as we all know, the digested food stays in the stomach for ranging from 4 to 5 hours. So if let's say they immediately go to sleep after meal, it can worsen the reflux symptom as it start to accumulate. Of course, they are sleeping at the time, but they will wake up in early morning around 3 o'clock, 4 o'clock in the morning having pain or having regurgitation and because of the reflux. Okay, as we all know, prevention is better than cure. So pertaining to our discussion today about GERD, I always advise my patient to always have a light, frequent, a less amount of meal, but make it frequent. So it actually gives time for your stomach to work.
Yes, true.
Yes. So, and at the same time, I always advise them to have this, we call it a half quarter rule. I think you all, heard this before. half of the plate make it green.
True.
Consists of just purely vegetables, not only one type. You can make it at least 2-3 types of vegetables, whatever you are okay with. And the another quarter is just your carbs, rice, for example, or bread, and then another quarter your protein, eggs or meat. So if you can do it, do it this regularly during your lunch or dinner time, it makes your symptoms better.
That's very true. So speaking of this, right, if between these two things, I will definitely follow the first rule first, which is just now, as you mentioned, have a less but a frequent meal. And because this will give the time for the stomach to digest better, and it will improve the gastric emptying, right?
Definitely.
So is there any patient feedbacks after practicing all this lifestyle change?
Yes, among the most common question that I ask to assess the severity is, I just ask them during a year or half of the year, how many times do they come to our casualty or to our AD to seek treatment? So it's somehow similar to an asthmatic attack. How frequent they get this attack? If they say about once or twice or not even thrice about a year, then it's okay. Compared to some different patients who are not compliant to the medication, they always come to ED every month or weekly or even on a weekly basis. So it reflects their compliance to medication. So that's how I assess the severity.
So prevention is better than cure. Do not enter the emergency department, right? So thank you so much for sharing us some of the significant lifestyle change, and you've spoken about the quarter half, right? But we have also some other home remedies or other own remedies that the people with GERD used to do to ease the heartburn. So for example, drinking milk, is this helping?
I always advise my patient, some patients, they do respond well with milk, but not all the rest, not for everybody. Because some of them are actually lactose intolerant. So I prefer for them to take a skim milk or low-fat milk rather than take a full-fat milk. Or another alternative is by taking plant-based milk, for example, an almond milk or a soy milk rather than a full-fat milk. This helps to reduce the acid reflux symptoms.
So here are some of the examples that doctor has given, like some low-fat meals, alternative plant-based meal will be a lot better choice compared to the full cream milks. So people with GERD certainly have to avoid certain food that can trigger the heartburn. And food commonly known to be heartburn triggered will cause the esophageal sphincter to relax and delay the digestive process and letting the food sit in the stomach longer.
Okay, Shanice, when we talk about the dietary restriction in GERD, among the worst culprits we are talking about is basically about those meals with high contents of fatty acids.
True.
Fried food, fast food, all these processed food like cheese, pizza, sausages, burgers, and potato chips, chili powder and pepper, fatty meats like bacon and sausages. These are all among the culprits that can worsen the reflux symptoms.
Yes, true. So just now you mentioned about the fried food, fast food, sausage, pizza, cheese, and all this food, and some of the herbs like chilies, pepper, all these things, right? They are all so nice, right? But they are actually can worsen the GERD symptoms. So there are also other food that can cause the same problems. For example, some citrus fruits, even though they are healthy, they are high in vitamins, but these are certain citrus fruit will actually cause some negative effects to all the people who already have GERD. And also chocolates, peppermints, or especially those carbonated beverages, right? So all these things, it will worsen the GERD symptom.
Agreed, because these citrus-based drinks, like oranges, peppermint, carbonated drinks, they all cause relaxation of the sphincter, the lower edge of the sphincter. So allowing more acid to enter the esophagus. So even the fatty foods just now also stimulate more acid in the stomach. because they are a solid food. They stimulate more acid production. So when there's a more acid production, there'll be more, risk to get acid reflux.
Okay. It seems that all these food are like have to avoid already. But don't be disappointed because of course there are also other plenty foods that can help to prevent acid reflux. For example, alkaline foods such as bananas, melons, cauliflowers, and nuts. So all these foods that have low pH are acidic will be more likely to cause reflux, whereas those with higher pH are more alkaline. It can offset the strong stomach acid, which means that alkaline foods is better in terms of helping to relieve the GERD symptom. And also, watery foods, for example, those fruits or vegetables that are high with water content, like celery, cucumber, lettuce, watermelons, or some herbal tea. So eating food that contains a lot of waters can actually dilute and weakens the stomach acid.
I agree, because basically when you talk about the acidity of the stomach, you need to take food which can balance, counterbalance the acidity in the stomach. You are encouraged to take those foods with more, which is more alkaline. You mentioned about all these vegetables, high fiber diets. Of course, it helps in terms of your digestion. It helps to improve your gastric emptying, and it balances your pH or the acidity of the stomach. I agree. So that's why I always advise my patient to take at least, if you the whole plate, make it half of the plate as vegetables, which is very high in fiber.
Yeah, that's right. Well, dietary triggers for these GERDs can be very personal because it's changed between different individuals, and there are also few foods that are more triggering than others. So it's best to avoid them to relieve the symptoms of GERDs. And before medication comes in, right, supplement could also be one of the solutions to heal the stomach lining. Do you have any comment about this? Like what type of supplements, the content or the ingredients that would be useful?
Okay, when we talk about gastrointestinal disease, the most common supplement we always brought up is zinc. Because zinc plays a major role. If you were to talk about at cellular level, it helps in DNA synthesis, it helps in protein synthesis, and it is involved in many enzymatic process in the cell itself. And at the same time, it's an anti-inflammatory. So if you talk about esophagitis or even gastritis, peptic ulcer disease, zinc is actually good. So where do you get zinc? You can't get. It's not really synthesized in our body. It's an essential nutrient. You get it from food, from whatever you take.
True.
So it's abundant in seafood, like oysters, mussels, seafood like crabs. These are food that have a high content in zinc.
True.
Even eggs or dairy products like cheese. Little bit of cheese, not so much, milk, and also even meat, red meat.
Yes, correct. So Dr. Khairil actually spoke about meats and all this, the cheese and all this, right? He mentioned rightly about not too much, which is the amount and the portion is very important. And also, Doctor also mentioned about the importance of zinc is actually, the abundance of zinc is actually found in all the seafood, where seafood cannot be overeat as well. So if you would like to seek for a certain alternative, you can go for supplementation already, right? It's important to know the ingredient of the supplement which you are taking to ensure long-term healing of the stomach lining. And for example, there are also other ingredients which we heard of in the market is fermented soy peptide, and also some of the nature's ingredient called licorice root extract, and they are actually the natural remedy for fast relief of acid reflux and healing of stomach lining. So what do you see about all this ingredient?
Okay, I've been reading a little bit of this soy peptide, licorice root extract. They are actually a large molecular protein that later broken down to a smaller amino acid. So it has got multiple action. And it has got an anti-inflammatory effect, antioxidant, as well as a lipid-lowering agent. It helps to control the inflammatory process when you have esophagitis, as well as gastritis. and it reduces the reflux symptoms. And if you talk about licorice, for example, it contains a high source of mineralocorticoids. So these mineralocorticoids is actually improve sodium and also water reabsorption. So when you have enough fluid in your body, you can reduce the acidity in the stomach especially.
Okay. So in general, the licorice root extract, it will help to reduce acidity in the stomach.
At the same time, it also reduce the level of cortisol. So as we all know, cortisol is a stress hormone.
True.
When it reduces the cortisol level, it reduces the stress as well.
Yeah, stress has been unavoidable for all of us, and our emotions will be reflected on our body too when we are too stressed, because I guess everyone knows that stress will actually trigger the inflammations, and this inflammation will actually lead to other health issues as well. For example, trouble sleeping, like tight muscle, anxious, or even having problem with recalling things, feeling mentally fatigued, easily distracted or confused, or brain fog. So these are highly related to the current fast-paced and stressful lifestyle. And GERD can be triggered by emotional stress, right?
What happens is that during stress, you get this, we call it a flight and fight response. It's actually, in medical term, we call it there's an increase in sympathetic activity. So if you notice when you are stressed, your heart start beating fast, you start breathing fast. So, and then of course they need more blood. These vital organ like your heart, the lungs, they need more blood. So more blood are directed to these vital organs. So what happens is your stomach receive lesser blood supply. So because of the less blood supply, the stomach become more inactive. We call it aperistaltic, or you get gastroparesis. So because of the stomach is not that active, there will be accumulation of acid, too much accumulation of acid in the stomach. You get, dysfunction of the gastric emptying process, and then you get reflux. So that's why when you are panicked, you're prone to get vomiting.
We hear rightly, actually, practicing mindfulness is really important nowadays, and it is almost inevitable for all of us to avoid stress. So having good rest and a good sleep are very helpful, right? So if you are facing any issues in sleeping, such as having troubles to fall asleep, you should really seek for solution as soon as possible.
I agree, because stress, as we all know, is not only common among patients with reflux disease. They can also occur in patients with, heart attack. Stress also can induce diabetes. They induce insulin resistance. So the development of hyperglycemia. So whoever have stress, we need to tackle properly, because when they are stressed up, they are more prone towards bad habits, like smoking and alcohol. So it's like a vicious cycle. So if you smoke, if you consume alcohol regularly, you're more prone to get more diseases, especially reflux disease.
Right. So yeah, it's really important to manage the lifestyle change and also try our best to practice mindfulness and to try to avoid stress or find ways to manage the stress or cope with the stress. Speaking of the two ingredients, VitaHealth has a supplement called Charge Up Gastocalm. Now let's take a look at this video. Charge Up Gastocalm features two patented ingredients, which is the Gastro AD and Gut GERD in refreshing chewable tablets. So it helps to relieve heartburn rapidly in just 15 minutes. And what makes this Charge Up Gastocalm special is, if it's taken in the long term, it will heal your stomach lining. So what you need to do is just take 2 tablets 1 to 4 times daily, depending on your severity. You can either take it 30 minutes before meal or after meals. I really learned a lot from the conversation with Dr. Khairil today. And we have talked about ways to take care of our guts. And before we end this episode, what would be your 3 tops key takeaway message for all the people here?
Okay, as we all know, GERD is common
Yeah.
among community. So please, at least we know what are the signs and
Yes.
symptoms of GERD,
Mm-hmm.
and please seek medical treatment early because prevention is better than cure.
Yeah.
So don't worry. Most of the time, we can manage GERD medically, not necessarily requiring surgery. And it is safe to say that GERD actually happened as a result of our bad lifestyle habit. So we need to live a happy lifestyle. Manage our stress well.
Yeah.
And reduce our weight.
Yes, that's true. That's true. Reduce our weight. So that's whole things means that really lifestyle change and dietary change is really important. And I'm so thankful for all this information, Dr. Khairil. Thank you so much for your valuable insights. And it has been really wonderful to having you on this episode. And we would also like to thank our audience here for tuning in. So please help to like and share this episode of Health on the Beat with all your friends and family. And don't forget to follow our Facebook, Instagram, and Xiaohongshu for more interesting updates. So if you have any feedbacks for us, you can message us through VitaHealth Malaysia Facebook page, and stay tuned for our next episode of Health on the Beat. Take care and stay safe. Bye.